Okay, so today we're just yapping. I'm Dr. Aubrey Capen. I'm located in St. John's, Michigan, and today I'm gonna yap with you guys about how oral health impacts your overall health. And I'm gonna touch on my journey and just how much it's played a role in even my own health. So when you think of your teeth and your mouth, that's your, oral health, right? The tissues, everything, we want to keep it healthy. That's why you come to see us for routine cleanings and exams. And when we find decay or cavities, we have to do fillings and treatment and things like that to get that bacteria out of your mouth. We have so many patients with so many different conditions, and I think that now there's this big movement for continuity of care and oral health and systemic health and the roles that they kind of play with one another. So as a dentist, I work with so many different doctors and I do medical consults because if someone has diabetes and it's not well controlled, that can be showing up in the things that we do here in the office. We can see bleeding gums and we can see just really angry red tissue. So when patients sit down in our chair, we'll ask a lot of questions about their medical history and health, and that really goes hand in hand with what we find in the mouth. Another example with diabetes is we'll ask patients, what's your hemoglobin A1C? And, if that's not well controlled in a healthy range, again, we see things like that in the mouth. Sometimes patients will present to us with really odd symptoms and we'll actually get to the root cause, and it has something to do with their sinuses or, a systemic condition. Maybe they have celiac disease and, we're seeing different ulcerations in their mouth and they had never even been checked for that. So we work hand in hand, and the things that we find in your mouth can be so valuable to finding other root causes of other diseases or conditions that you may have. So it's pretty darn cool, and it's always a journey, and sometimes we don't just have all the answers right on the spot, but working with other medical professionals, we get our way there. With systemic health, things like heart disease, Alzheimer's, diabetes, we are seeing correlation with, gum disease, so periodontal disease, and the enhanced, the rapid progression of that disease. So some of our patients that present with quite a bit of bone loss, and, we talk about periodontal disease, they'll say, oh yes, I also have diabetes or heart disease or Alzheimer's, and some of those patients, they're not well controlled, or maybe they don't have that diagnosis yet, and we start to discuss periodontal disease, and then they see their primary care physician and additional tests are run, and lo and behold, they actually have a systemic condition. So what we see in the mouth, like I said, with bleeding or inflammation, things like that, that's not normal. So that tells us that there is a root cause. There's something else going on beyond just, what we're seeing. So it goes systemically, where we want to try to find that root cause and work with you as the patient and work with your doctors as well to figure out how we can combat that and make you feel better, and just overall, not just your mouth. So there has been a lot of research recently coming out with mental health and things like dementia, Alzheimer's, this cognitive decline and ties to periodontal disease. So the bacteria that's being harbored in your mouth is playing a huge role on your overall health. And like I said, recent research is showing that it has a huge impact on the health of your brain. In the past, there's been lots of studies about heart disease and diabetes. Again, that oral bacteria that's really fighting against you is also not just in your mouth, but it's traveling throughout your body. So it is just so important to see your dentist. And if you have signs of bleeding or redness or sore gums, again, that's not normal. I always tell my patients, does it hurt to brush your hair? Okay, well, it shouldn't hurt to brush your teeth or to floss your teeth for that matter. So if you have signs of sensitivity or concern or pain, you should definitely see a dentist. with periodontal disease, it can go undetected if you're not routinely being seen by a dentist. How we diagnose periodontal disease, gum disease, as a lot of people refer to it as, would be with the probing depths. So those are the little measurements with our tiny ruler where we walk around the gum tissue, around the tooth, and we assess the health of your gums and your bone levels. And then the x-rays show us too if you've had bone loss. And if that goes undetected, so let's say you don't see a dentist for 5, 10, 15 years, or that's not treated. If it's left untreated, over time that can very much lead to things like dementia or Alzheimer's. And it's really crazy what the research is showing now, the ties between the two. So small daily habits and oral hygiene habits like brushing twice a day, flossing, taking care of yourself in that way really compounds over time. And it plays a huge role in your overall health and the way that you feel, as well as, eating healthy whole foods, trying to reduce processed foods, really ensuring that you get enough protein and fiber in your daily diet. It's huge in how you feel. And why this hits so close to home for me is in 2019, I was very overweight. I was in undergrad, I was studying, I knew I wanted to be a dentist. For those of you that follow us on TikTok and other social media platforms, I talk about that. I've always wanted to be a dentist since I was a little girl. And when I got to Central Michigan University, I was studying so hard for the A's. And it was organic chemistry and biochemistry, and I was the president of the Pre-Dental Society, and I'm trying to do all these things. I wasn't prioritizing myself. Of course I was brushing and flossing. I'm incessant about my teeth, but I wasn't eating right. I wasn't moving my body. I wasn't prioritizing myself or taking time for those small habits. And my physical health suffered. And at the time, I don't think I really saw my mental health suffer. I certainly wasn't confident in, myself and didn't want pictures taken, but it's one of those things. I just kind of wasn't putting myself first. So when you can start to move your body and maybe it's a simple daily walk, right? Just showing yourself, proving yourself over time. Okay, I can, get this movement in. I can eat healthy whole foods. I don't have to, focus on fast food or all these processed snacks and, just really start taking care of yourself. You will see the benefits, oh my gosh, just multiply. I seriously feel like a whole new person, and it's 6 years later since my journey, I say, really kicked off. But it is absolutely incredible that small daily habits, so brushing twice a day, flossing, those are small habits, walking, eating whole foods, it can change your entire life. I'm kinder to myself, and I like to think I was always kind to others, but I'm certainly more patient. My hormones are more balanced. I look in so many mouths every day, and I look at all these teeth, and I tell everybody, you can't go back in time, and that's okay, but we can start right now, and each day we can try to be 1% better. So maybe you don't floss at all. You hate floss. Okay, no problem. Let's try to pick up the floss and floss once a week. When you get that down, let's try twice a week. Okay, you get that down, let's try 3 times a week. Before you know it, those results are compounding, because I guarantee if you're picking up the floss, maybe you've convinced yourself, okay, I can go for a walk. Okay, I can do 1 push-up. Okay, I can do 10 air squats. And then before you know it, that's compounding. And I guarantee, it sounds so cliche, but it will change your life. So go buy some floss today and let me know how your journey goes. Here at St. John's Dental Care, we take an overall health approach. And what that means is we want to look at your medical history. We want to know if you have had joints replaced or you have systemic conditions. And then we take a comprehensive set of x-rays and we look in your mouth and we tie everything together. It's all related and it's all tied together. So we want to ensure that you are pain-free, that we can, combat any concerns that you have and just keep you as healthy as possible, even if that means, talking to your primary care physician or a specialty doctor that you see frequently. It's so important for us to know the medications that you have and your medical history so that we can properly treat you here in our office. And above all else, we just want you to feel comfortable and safe here. We want you to feel at home. You're a part of our family.